Good afternoon, ladies and gentlemen. Thank you very much for being here and listening to this presentation. I have been given the topic of adapting your wellbeing strategy to support the sandwich generation. And what I thought I'd do is look at this in three ways. I've got 20 minutes, so I'm just going to take my watch off. 20 minutes to talk to you about this. Who are the sandwich generation, and really, why should we care? The second thing is, what are the issues that this group of people within the workplace are experiencing? And finally, what can you do, and how can you do it in terms of developing your health and well-being strategy within your organizations and within your businesses? So, first of all, okay, who are the sandwich generation, and really, why should you care? Sandwich generation, I guess it's a relatively new term. Certainly, maybe 10 years ago, we wouldn't have been using this expression. But this is, I actually just did a Google search, and this was the first thing that came up in one of the dictionaries. A generation of people typically in their late 30s to early 50s, responsible for not only bringing up their children, or at least supporting their children in some ways, but also looking after their aging parents. How many in the room fall into that category? Yeah, good 40%, I guess. Yes, and actually it is going to increase. This is employment within the UK. And what we see is that group here, that's 35 to 49-year-olds, and if you just take the beginning part of this group here as well, most of these people are employed. They form a significant part of the workforce. They count for about just over a quarter of the workforce. And as we gradually age, we're probably going to be seeing more people within this group, this sandwich generation group. So it's not just a small little cohort of individuals. It is actually a significant proportion of your working population. So, okay, that's them. This is who they are. What are the issues that they are experiencing? We do a survey at Cigna every year. This is the 5th year we've published the results of our Cigna 360-degree survey. And we do this over a number of different locations around the world, in fact, 13 different geographies this year, and ask employees what are the key issues that are affecting their health, well-being, and sense of security. And these are the results, some of the results that we're coming back. And certainly over the last few years, we've seen an increase in the number of people who are saying that stress and mental health are key issues for them. They're also saying their finances are a cause of worry, a cause of concern. Will they have enough money? Do they have enough money to support their children? Do they have enough money to pay for social care for their parents? Because the personal health and family health is a real issue. Again, this is a broader topic. How do we pay for comprehensive health care for populations? We know here in the UK that the NHS is really struggling, and I think it's evident that that is on a lot of people's minds. How do they manage their finances? How do they manage their family's health? And then finally, the impact that a lot of these stresses have on relationships, on personal relationships, relationships with children, relationships with spouses, with parents, the workplace in general. So that probably comes as no surprise to you, especially I think if you're working in HR and benefits, etc., within an organisation, that these are the key issues. But I think these are exacerbated by the times that we live in. We live in some very uncertain times. And it's clear from our survey that these things are starting to impact upon people as well. The job security side of things. People don't feel secure, or they often don't feel secure in the jobs that they are doing. It's not unusual for people to move between different jobs, either because they're seeking something new, but often because businesses are failing. We have so many businesses that are, once the foundations of our economy are contracting in size, potentially even failing. We have economic and political uncertainty, probably no more so than in the UK. What is Brexit going to look like? What impact is it going to have on us as individuals and the economy? And then also, let's not forget as well, personal and family safety. There are real concerns in the world with regard to terrorism, with regard to keeping safe in our day-to-day lives. So it is really no surprise that these are things that are impacting our employee base. But particularly our sandwich generation, those individuals who have more stress outside of those areas. They have more stress because they're trying to do the best for their children, because they're trying to do the best for their parents. This was quite interesting data that came out, and this was European data, so this was from the different European geographies that we surveyed. And what we found, not altogether surprisingly, that just over half of people said that they actually had significant levels of stress. And if you do surveys within employee populations, etc., this is not an altogether unusual finding. But what was quite interesting was that 13% of people said that they really found this unmanageable, that this was really having a big impact upon them, upon how they functioned, both in work and outside of work. Again, not surprisingly, we see our colleagues every day. Significant numbers of us are seeing stress and the rising burden of that on our work colleagues. But also, what was quite interesting this year round was that a lot of people attributed this always-on corporate culture to driving some of this psychological distress, this stress that is occurring. The fact that we've always got our email with us, our mobile phones with us, we have laptops, we can work anywhere. We're expected to work anywhere in many organizations. And that was really something that was really quite profound this year in terms of the proportion of people who stated that was an issue. So, yes, although we're talking about the sandwich generation, who are they, what are their issues, this is actually relevant to across the whole population, but probably just a little bit more acute within this group. So what can you do and how should you do it for these individuals? Now, there's lots of people here, there's lots of people out there in the exhibitor hall, there's probably lots of you here as well, who can tell organizations how to implement a well-being strategy. Sue earlier on was talking about benefits. How do you create benefits? Okay, that's part of your health and well-being strategy. How do you implement that? Well, there's many different elements that go into really executing on a strategy. Here are some of them. You have to actually develop your strategy first of all. You have to get buy-in from a variety of different people, etc. I won't dwell on that because I think that's pretty well known, or certainly there's many people out there who can help you with that. What I thought I would concentrate a little bit more on was what are the different elements, particularly taking into account the sandwich generation, those people who are a significant part of your workforce, who are struggling to a greater or a lesser extent because of pressures both within the work environment, but also pressures outside of the work environment. Coming from a health insurance company, it's probably not a big surprise to you that I put as our foundation a private medical insurance provision. From our survey results, it's quite interesting. Those individuals who had private medical insurance provision, that's not just in the UK, but around the world, those individuals who had private medical insurance provision were much more confident and much more positive about the future, about their future ability to cope, about their future ability to manage especially the financial stresses and strains, but also the health-related stresses and strains that their family are having. And so that was really, really quite interesting. And I think, you know, as part of a foundation, that is great. But as we've said, and as people previously have said, you know, that's actually fixing problems, generally speaking, once they've occurred. What else are this group wanting? What else are they saying that they need or would help them reduce their levels of stress and concern? A corporate well-being program. Quite interestingly, you know, I find this surprising. I've been working in this area for almost 20 years now. 60% of the people that we surveyed in Europe said that they had no access or no easy access to a corporate well-being program. So, you know, I really do believe that as the cornerstone of what you do as a business, if you're really serious about the health, well-being, sense of security of your employee base, a health and well-being program has to be there as part of it. What that looks like, how you implement that, you know, it's very individual and it should be very personalized to you as an organization and the people that you employ. Sue mentioned this earlier on in her talk, flexible working. This is a really key thing within the sandwich generation. She touched on it, I think, but I think it really is important. You know, it's not just those individuals who have small kids, you have to take them to school, etc. It is that whole area of having that flexibility of when you work, how you work, and to a certain extent on what you work on. With us in the knowledge economy, it's so much easier to give someone a laptop, a mobile phone, and they can work anywhere. Certainly in my role, that's true for a lot of the time. So flexible working, I think, is one of the key areas. And many organizations now are actually reducing their physical footprint, recognizing that having a flexible, mobile workforce, it can actually deliver some really good productivity metrics for them, but also reduce their operational expenditure as well. So certainly something to think about, and if necessary, to put in place a policy for flexible working. Virtual healthcare. We've talked, and many of the previous speakers have talked about physical healthcare, individuals going to hospitals, going to places of care. With the increase in technology, with the ever-advancing technological innovations that we carry around in our pockets now, we really are at that stage now where virtual healthcare, video consultations, video advice from healthcare professionals is a reality. It's something that we're doing at Cigna, and you know, many of our competitors are also doing this in the marketplace, in that trying to change people's perceptions of how they access care, what is an acceptable healthcare interaction, both in terms of what they feel like themselves, but also broader, the broader impact it has upon the employer. You don't have to necessarily go to see the GP, go to see the consultant for all things. I'm not saying that this is a panacea, but certainly having virtual healthcare or the provision of virtual healthcare for this pretty technologically enabled group of people within society and within your employee base is a good thing. In our survey of the world and the world's employees, 59% said that they were willing to engage with this. Not necessarily that they had. If you look at the numbers of people who actually have engaged, it's much smaller, but they're willing to. So there is a willingness and a desire to look at this in some ways. Financial products. This is quite an interesting one. As well as your private medical insurance, people are looking for other forms of security, other forms of a safety net, if you like, for themselves, especially this group of sandwich generation people who are looking after these two groups of within their family. Financial products, pensions, life insurance, critical illness cover, etc. They're starting to think about these things. So I thought that was quite interesting. targeted preventative and early diagnostic care. We're pretty poor as a nation, and it's not just us in the UK, I think just generally speaking, we're pretty poor at being very good at preventative healthcare, you know, getting your appropriate screenings, getting your annual health assessment, physical, etc., looking early for common conditions, diabetes, heart disease, cancer, etc. So again, the provision of those sort of things is starting to weigh a little bit more on these on this cohort of individuals, these people within the workforce who are in their sort of late 30s to early 50s. Not surprisingly, they're getting a little bit older. They're a little bit more in touch, if you like, with their own mortality or what might go wrong with them. One of the key things, and one of the takeaways that I had from the data that I'm sharing with you is easy access to mental health care services, to you know, counselling and psychologists and help. And again, this is the other side of that. You know, lots of people are experiencing quite significant psychological stress, as we sort of shorthand call it, but also people are saying, actually, you know what, I recognise this, or I recognise it in myself or in my colleagues, etc. It would be really good if you could provide me with something where I can easily access the help I need. I don't want to go through my GP. I don't want to go through, jump through these different hoops that my private medical insurance normally makes me jump through. I don't want to wait because the NHS takes so long to go and see a psychologist. I want to get there really quickly. And so that's something that we've been listening to over the last 18 months or so, and have implemented a pathway so that individuals can call up one of our customer services agents and say, look, I need to go and see a psychologist. I need to go and see someone. I'm really struggling mentally with work, with family, with finances, whatever it is. And we can then put them through that pathway with one of our preferred providers. And the feedback from that has been phenomenal. You know, rather than that wait, go and see the GP, get a referral letter, etc., we're now seeing actually that people are being connected up with an appropriate professional within a couple of days. That is something that they were saying. Something that people have mentioned earlier on, I think the lady from Generale mentioned second medical opinions. Again, this is something that this cohort of people are starting to say, you know what, I would really like the ability to easily get a second medical opinion, whether that is in person with a doctor or a more remote second opinion where I gather everything together and get someone to tell me whether my father, my mother, my child's health condition is what it is, and whether the treatment plan that we have in place is the most appropriate. So I thought that was quite interesting. So we've talked really briefly. This has been a lightning stop tour of who the sandwich generation are. You should care about them. They're a significant proportion of your workforce. They have issues. They are similar issues to the rest of the population, but more acute in some of the areas: the health, the personal health, the family health, the finances, etc. They're really stuck between the two there. And there are some real tangible things that you can do to address the needs that this group do have. So back in 1965, the WHO released one of their seminal works, My Generation, and the much quoted line, I hope I die before I get old, has not come to pass for many people. We're getting older as a society. Two of the members of the WHO did, in fact, manage to execute on that request, but two are still going. Roger Daltrey, 75 years old, still, and they're playing Wembley, I think, in a couple of weeks' time. And just to show my age, that was actually the first band I ever saw in 1980. So thank you very much for listening. I hope you found it at least moderately interesting. And all the best for the rest of the day.